Welcome to the Dental Practitioner Podcast. Today I'm joined by Professor Marcus Blatz, Chair of Preventative and Restorative Sciences at the University of Pennsylvania and founder of their CAD/CAM Ceramic Center. Originally from Freiburg, Germany, he's built a global reputation as a leader in aesthetic, implant and adhesive dentistry. He's also the President-elect of the International Academy of Adhesive Dentistry, a prolific researcher, award-winning teacher, and an in-demand speaker around the world. Professor Blatz, welcome to the show.
My pleasure. Thanks for having me.
Thank you for coming. You've come all the way across the world, and I believe you arrived only a couple of hours ago, so thank you for making the time. Welcome. What brought you to Australia this time around, and what are you looking forward to doing?
Well, we're celebrating 40 years of CEREC. So we have a 2-day course coming up where we go pretty much in depth, not just about digital dentistry, but also material science, bonding, things like that. 2 full days of immersing into modern dentistry.
So you're quite prolific on social media. For those of you that aren't aware, there's about 250,000 followers on Instagram. I believe this started because you wanted to fight against misinformation. Can you share a little bit around that story and how it's grown over time?
Well, that is correct. It was not, it was not intended to become an influencer or something. It was more out of frustration of the misinformation that I saw. And I will never forget, it was the first time I went on Instagram, right? And I look at this and I say, it was so fundamentally wrong. I mean, it was actually a zirconia resin-bonded bridge, one of my topics that I have, of course, researched for so many years. And I look at this, and somebody, put prep pins in the tooth and said you cannot bond zirconia and this and that, and thousands of people liked it. I said, this is unbelievable. How can this be? And I said, Marcus, you got to do something. And this is when I actually started to understand how many people use this tool. I mean, I'm education. Of course, that's my calling, basically. But I did not understand how many of our young colleagues, how many of our students learn from that almost exclusively. And this is when I started to post. But the only thing I don't post anything about myself. I don't post anything about family stuff. I just only post about dentistry. And it is dental techniques, protocols, procedures, but based on science. So there's always evidence behind everything that I post, or if there's none, I at least explain it, why we do that, because that's the big thing. Why do we do things?
I believe it's such a fantastic service. I do a bit of teaching at the university as well. Nothing like what you do, but the influence of social media on techniques and procedures is profound, and I think it's wonderful what you're doing, so thank you. You're in Australia at the moment, doing a presentation and lecture series for Dents Plus Corona, Back to the Future. What are the topics you're going to be covering, and why is it important to be covering those topics now?
Well, we have 2 full days, and what we're going to do, we really will go from, typically how I design courses like this is we start from some fundamentals, because that's often missing. What is good science? What can we do to help our patients? The main theme around it is, what can we do to help our patients keep their teeth as long as possible? That's always the main theme, because that's what our duty is as dentists. Help our patients keep their teeth as long as possible. That starts with treatment planning. What tools we have available right now? Digital tools to help us to really make a patient-centered treatment plan. What is the science behind it? And then we go into some fundamentals in aesthetics, because that's what many people know, some of those rules, but don't really implement them in their daily practice. So I really kind of tell them how we can assess aesthetics better and then implement it in a restoration, no matter what it is. And we start then with things like flowable injection technique, right? We go into veneers, ceramics, and as we start into the indirect restorations, how can we make them less invasive? We talk about bonding. And bonding is such an interesting topic, because there's some people still say, oh, we cannot do bonding well, because they don't understand the why. They don't understand, if you have some at least fundamental understanding of material properties, what is a silica ceramic, what is a high strength ceramic, what is a composite, and when you have at least some understanding of that, you can make your own decisions. And that's what I want people to do. Have a fundamental understanding, and then be able to make their own decisions. What kind of bonding agent do you use? What kind of surface treatment do you have to do? So from the veneers, we then go into the posterior, partial coverage, something that I grew up with in a dental school in Germany. I come to the US and people say, we don't do it. It doesn't work. And I said, wow, that's news to me. We have data like decades.
And when you say partial coverage, you're talking about onlays and that
exactly.
sort of restoration.
Onlays, vonlays, veneer lays, whatever you want to call them. And we also deep margin elevation, things like that, hot topics, right? But explain it, because all these techniques are very technique sensitive, right? And if you don't understand why you do it and how to do it properly, that may lead to failure. From that, we go into the more full coverage. We still have to sometimes do full coverage restorations, of course, discussing zirconias, but then also resin-bonded bridges is one of the key topics in addition or maybe before placing implants. And from the resin bonding, of course, resin-bonded bridges need to understand how to bond zirconia and those materials properly. And then we go into implants up to full mouth reconstructions, and that pretty much covers 2 full days of, I think, immersion into these topics as deeply as we can.
It sounds like your why is arming clinicians with the information they need to make the best decisions they can in partnership with their patients.
One thing I don't want them to be dependent on information that get either from, again, sources that may not be reliable, or companies. Of course, we work with many companies, but also they have an interest to sell, which is okay. But you can make decisions what materials to use much better when you have a fundamental understanding.
And that purpose and drive to help our patients keep their teeth for as long as possible.
Of course.
You've been a pioneer in digital workflows. How have you seen it evolve over the last decade? And what excites you about it into the future?
We have started CAD/CAM technologies back in the early 2000s. When I arrived at Penn after spending a couple of years in New Orleans, by the way, to work on my Habilitation, which is like a second PhD in Germany, supposedly only for 2 years, but became 5. And then I started at University of Pennsylvania in 2006. And the first thing I said, we have to be more CAD/CAM digitally oriented. I hired some specific people. I had a dental technician from Germany who was a master in using digital technologies. We built a whole center where we do research, look at accuracy, look at different material properties in a very specific way to kind of have a focus area, right? I don't want to know everything, but I want some areas that I think are important and that I'm excited about, I'd like to evaluate further. We did that very systematically, and this is not, again, just for making restorations or understanding the technologies, but also for teaching it properly. And that was actually in the early 2000s when we started this process.
That sounds fantastic. So it sounds like at that point it probably was an early adopter technology. Where do you feel we are now in that process or drive in terms of early adoption or mainstream? What has your experience been, and where do you think we're up to?
The phase of lockdown during, the pandemic was one that I think helped many people to get better informed about it. We could see a big jump during that phase, actually. Before, I know what exact percentage was here in Australia, but in US it was relatively low. But there was a big jump after the lockdown and people getting more interested in it and, of course, using the technology more. For us, it's pretty much a no-brainer because we teach digital dentistry from the very beginning. In the beginning, actually, early on, like still so many institutions do, they say, oh, now you're ready for digital dentistry. So as like an add-on, right, in your education. You did so well, so now we give you this little bonus. I understood that it's not the right way to do it. We turned it upside down. When they come to our school, even in the pre-clinic already, they learn everything about it. They do digital smile design. They learn how to scan. They learn how to design. They learn how to mill. They learn how to... And this is why it's so important. If you don't understand fundamental material properties, you don't know, does this thing have to go in the furnace? Can you have to polish it? How long does it have to go in the furnace? What do you do to get the longevity out of the material? So this we teach from the very beginning on.
What do you think the biggest misconceptions there are? And you're talking about statistics. In Australia at the moment, I believe 60% of practices have implemented some form of digital technology. What do you think the biggest misconceptions clinicians have, both those that are new into the field, but also those that have been practicing for 30, 40 years?
Yeah, the biggest misconception with all these technologies is that it will do everything for you, or it's make you a better dentist. It may help with the outcomes, but actually in some ways it may even expose your flaws, because analog dentistry, there was always something we could actually I started out as a dental technician myself. That's why I know much about that. You can get away with a not so great impression and still have a well-fitting restoration somewhat. Digital technologies does not necessarily allow that. It will allow you to have more precise restorations, but if your preparation, for example, is not spot on, if your scan is not spot on. So many people think, for example, that, it's so easy to take a scan. But unfortunately, we see a large percentage of scans being made not being acceptable. And so it does not do the job for you, but it can help you, to get better restorations at the end of the day.
What's an example of a scan that is inadequate?
Oh, the margin. I mean, the thing is that many people think, just put a scan in and it's going to be okay. So you really have to make sure that your margins are represented properly. That's why, but it's the great thing about having it on site, for example. So whenever a student takes a scan, for example, before we even go into the production, we have a dental technician check it and say, hey, the patient's still sitting in a chair. Oh, there's one area you didn't capture properly. So you can just go back and rescan it before the patient even leaves, which is great. Or, of course, if you have not a dental technician on site, you can do it yourself or somebody else. Make sure that you have a good impression. The thing is that with a physical impression, you're able to get some physical pressure pretty much on the marginal areas and sometimes get away, even if there's a little saliva or blood on the margin. With a scan, it's not possible. An optical scan, what you don't see, the scanner will not see. That's why soft tissue handling is so important.
Let's talk a bit about zirconia and CAD/CAM and adhesive dentistry, and I suppose where those three come together, creating both functional and aesthetic dentistry. I know you've done a lot of work in this space. What are the key takeaways you like your students or participants to walk away from a course with you to feel?
With digital technology, one of the great things is we can really plan ahead if you do it properly, of course. And with that, you can also see, for example, when you're creating veneers, onlays, or whatsoever, you can really plan very carefully and make your preparation based on that plan. And that's one of the key things in general for minimally invasive dentistry. Digital technologies really help tremendously with that, because you can see exactly how much space do you need. Because a big misconception is also that people, I make this prep and they all look very similar, not understanding that the only reason for the prep for those adhesive restorations is to create space for the ceramic. You're only creating space for the ceramic. So when you plan an onlay, for example, and you want to increase the vertical dimension by 2 millimeters, you need hardly any prep, if at all. And this is, I think, one of the great advantages that we have with this. When we talk about resin bonding to zirconia, for example, right? Resin-bonded bridges is a key topic that can help young patients that are not old enough for implants. We placed implants way too early. I have to blame myself. Cases that I saw that I did myself. I was so proud of, 20 years old patient. It looks awesome. And then you look at it 5, 10, 15 years down the road, you're going like, oh my God, everything has shifted. Implant stays. And then what are you going to do? And there's several cases where, we had to take the implant out. Now we're suggesting to place implants much later than we did in the past. And so resin-bonded bridges, for example, are great ways to help with that. If you have no space or the patient doesn't have enough money, it's really a great technique to do so. But you have to understand the fundamentals. Still, many people say, you cannot bond zirconia, which I don't know where they got this idea from, right? And with the techniques that we have developed over the years, thousands, tens of thousands of specimens, basically, we can really bond to zirconia very successfully. Very nice studies that came out just, clinical studies showing 98% success after 15 years. And still be, I don't believe in zirconia bonding. How much more success do you need? And you know what the biggest misconception is? So some people say, for example, instead of using zirconia, I want to use a silica-based ceramic because it's easier to bond to. But what they don't understand is that we're talking about two bonding interfaces, one to the tooth, one to the ceramic, okay? As long as the one to the ceramic is as good as the one to the tooth, it doesn't really matter how much better it is, because the weak link becomes the one to the tooth.
The failure happens at the weak link.
Exactly. So as long as I'm as good as to the tooth, which we can achieve with these bonding techniques that we have right now to zirconia, I'm in good shape. And if you say, oh, but I want to use this, I want to use that, I want to use this. Yes, you may, but does it really improve anything? Because the results are pretty clear. We have the evidence.
And I think the wonderful thing about leveraging this technology is that resin-bonded bridges can be done with minimal preparation and can be made relatively cost efficiently now. And so having that as a provisional or a long-term provisional solution, particularly for the patient or case study you were talking about, I think is a wonderful way technology has made dentistry better, more efficient and more accessible. So I think that's quite exciting.
I mean, again, it's of course just a small area, but I think a very important one, because right now, and I mean, my training also included perio, so I did a lot of implants surgically as well. But we really are in a trajectory right now that I think there may be some people place implants too soon and not preserving the tooth.
And the opposite also exists. I also see in practice a lot of geriatric patients, a lot of palliative care, dementia, those sorts of things. They're not good candidates for implants. They may not even be good candidates for dentures because they don't have the dexterity or the cognitive ability to follow an instruction or be able to clean it or find it. So again, I do see this technology being able to help the other end of the spectrum as well.
Right. And again, I'm not saying we shouldn't place implants anymore, to the very opposite, right? But you have to understand when you place them and which patient you place them properly. Because people also think, oh, I just put an implant and it looks good after, 1, 2, 3, 4 years. But especially in younger patients, it has to last much longer and look good for much longer.
What excites you most about the next wave of innovation? Obviously, we're in a revolutionary time with AI. It's the buzzword. Everything's got AI in it. And as you and I both know, AI has been driving a lot of these technologies for a long time. I think where a lot of the public and dentists are starting to interact with it is more generative AI and that sort of thing. How do you see all of those worlds coming together to improve patient outcomes and the technology we interact with?
This is actually one of the most exciting areas right now, and of course something that we work on very, very profusely in every aspect. From the research side, of course, information gathering with use of AI is so much easier, so much better. We can really target it. There's so much data. It's actually almost too much data to really funnel through. In the clinic world, it really helps in putting all the pieces together, because that's where sometimes we still struggle, right? To bring the information and help people make the right decisions for a patient-centered approach. And I think that's really the key. And that's something we're working on right now very profusely, but not just in that area. I mean, clinically, of course, research-wise, but also in education. We have now systems available that help tailor our education programs to each individual student. So we can then determine where are their needs, what do they need to learn better, and have pretty much a system then guide them down that path so they can actually become better also with their learning, with their experience, with their education.
You touched on a term that's being used more and more, and that is patient-centered decision-making, care, values, however you want to frame it. It's certainly become part of our regulatory documents in Australia now, the expectation. Could you explain from your perspective what that means and how we leverage technology to drive that?
The advantage of using AI is, first of all, to bring the information together and not to overlook something, for example. I mean, this starts with radiographic evaluation. This starts with your scans, going into the smile design, and then being able to design the restoration, whatever it may be, based on the specific patient's needs, right? And taking in consideration all these factors that we may sometimes overlook. Of course, there's also a slight downside maybe associated with that, especially when it comes to diagnostics, because we can also see if people rely too much on that, they may lose some of their diagnostic capabilities. But on the other hand, I'd rather have that than overlooking something and then having a problem later on.
Yeah, look, we're definitely seeing that with the integration, particularly of AI, looking at radiology.
Exactly.
And where that's going to go will be very interesting as well over the next 5 to 10 years, and how, again, all of that information integrates.
Absolutely.
You've seen practitioners all over the world. What do you see as a difference between those that adopted the technology early as opposed to those adopting it now? Do you feel like, there's a point where it's too late to adopt these technologies, or do you feel like it's something at any stage in your career you can jump on board and get up to speed pretty quickly?
Oh, absolutely. At any stage.
You've done an amazing job of becoming an unintended influencer and influencing a lot of younger dentists all over the world. You also are an avid teacher and love teaching the next generation of dental professionals. What advice do you give them in terms of being able to embrace the change in technologies now, but also to develop a culture of developing over the course of their careers?
Well, first of all, when they come to the school, they don't know what is old and what is new. So, of course, the faculty knows. So some faculty, they may be more apprehensive to change, but the students, they don't know any better. So they don't know if you tell them, oh, this is better to take an analog impression than a digital. For them, it doesn't really matter. So that's why we start from the very, very beginning. Actually, I'm using that tool also to teach some of our faculty to embrace it more. But so I'm not so worried about them embracing technology. They are the technologically savvy generation. That's for them, it's absolutely a no-brainer. It's more that I don't want them to lose actually their hand skills. So we teach both. They still have to do a wax up because I don't think you can do a nice digital design, which is more difficult to do on a computer screen, if you don't have the hand skills to carve something else, especially when you have to do a direct restoration, for example. So we do that. But what we're always trying to do is, of course, with our teachings as to make them hopefully lifelong learners, that they keep up the excitement, that they keep up their engagement in education with those changes. And that's something, of course, we're really trying to instill into them. And so far, it seems working quite well.
And it's something we're passionate about at ADN New South Wales. We've just built our digital training centre to create a safe place for clinicians that have finished their formal training to interact with these new technologies and find where they want to get more involved in it and how they can add benefit to their patients.
And that would be actually my advice. If you ask me advice for dentists who are already in their practices, is take one of the courses, go to some of the companies, see what fits you, because you have to change your practice. That's a fact. And it has something that feels comfortable. But the thing is that in the beginning, to be honest, we had more problems with training our faculty than our students, and to convince them that it's for their benefit, that is for the benefit of their care, is I think one of the most important points to make. And then to go out there and look at what's available, take some courses, to get familiar with it, and do it. The most important thing is you have to do it. Same with magnification. We teach microscope from the very beginning as well. But if you don't do it frequently, you will lose it. So if you have a system sitting there and you use it just once a week, you will not get proficient. You have to get proficient with it. You have to use it. You have to change your practice towards it, and you will see the benefits very, very, very soon.
We started off talking about your Instagram account and how amazing a resource that is. I understand you have a book coming out that is pulling a lot of the information that you've developed over time. Could you tell us a bit about that book and how it came about and how you see it being used?
Yeah, I mean, of course, we do a lot of publication. We have a lot of scientific papers and books that we worked on or also published already. But I can also see that I saw that through this Instagram that the way that people learn is very different than we learn. So, I mean, you're much younger. I don't know if you still like textbooks or not. I can tell you, though, that many of our young colleagues do not look at a textbook. They like it maybe having it sit there and it looks nice looking at the pictures. But so the concept here was something, I would say, different from a traditional textbook to preserve the information on Instagram. I also see that, many of the posts have been forgotten like a week or two later. So what I wanted to do to preserve that. So I put actually by topic, the Instagram posts into a little booklet. It's not really a heavy book. It's a small booklet, small size, like a handbook, basically, a paperback, not expensive, but by topic. So the first one is actually on laminate veneers, where I use pretty much the Instagram content We had to modify it somewhat, but use the content, also the format, into a little booklet as a handbook for students, handbook for younger colleagues who don't want to read like pages and pages and pages, but still want to have clinically relevant information that's also evidence-based, and that's what it's all about.
Distilling those salient points into into an available resource.
And then it's kind of organized by different topics. First one is laminate veneers, next one will be onlays, third one will be resin-bonded bridges.
That sounds fantastic. So, Marcus, for those that aren't able to see you while you're in Sydney, what sort of message would you like to pass on to them in terms of them getting into more digital dentistry and learning more about adhesion with new technologies? What sort of advice would you give them to learn more about that?
I mean, of course, depending on what kind of resources that you prefer, social media, some of the courses, but what I see also pretty much gaining a lot of traction is actually hands-on courses. I do a lot of those because, again, these are tools that can help you with fabricating the restorations. But if you don't know how to prep a tooth properly, those tools are not so helpful. That's why I think, attend some of those hands-on courses. You guys are going to have a very nice center, I see. So I can only encourage people to take advantage of that.
Marcus, thank you so much for your time. It's an absolute pleasure having you, and enjoy your time in Australia.
I sure will. Thank you so much.